Are you ready to take your NCLEX prep to the next level? Join our exclusive YouTube Premium membership and gain access to powerful resources that'll help you dominate the NCLEX step by step. Bronze membership. For just a small investment, you'll stand out in our community with a special member badge, and you'll get priority message replies to ensure your questions never go unanswered. Upgrade to silver membership. You'll get everything in bronze plus exclusive members-only videos packed with NCLEX strategies. Practice questions on video format to test your knowledge and sharpen your skills. With silver, you're not just watching, you're actively preparing. Want the ultimate NCLEX advantage? Then Platinum membership is for you. Along with everything in bronze and silver, you'll get exclusive access to the next generation NCLEX Master Course. No matter where you are in your NCLEX journey, we have a membership tier designed just for you. Click the join button now and start your path to NCLEX success today.
Hello, NCLEX Crusaders. Let me know if you can see my presentation. Let me know if you can see me and if you can hear me. We will begin today's training very, very soon. If you can comment in the comment section so we can begin. All right. Hello. Gabriel from Africa. Gambia. Wow, welcome. Lisa, it looks like it looks good now. Like we were supposed to see it last time.
Really?
I think so.
Let me see.
I think it looks big. The presentation looks big today. I look a little bit smaller, but it's okay. And connecting from Kenya, Rhode Island. Very good. All right. Okie dokie. Let's begin. All right. Welcome everyone to day 2 of our EKG series. If you're preparing for the NCLEX, you know that EKG interpretation can feel overwhelming. Basically, all those waves, intervals, rhythms, it can get very confusing very fast. But today, I am going to share with you a simple and powerful strategy that can help you make sense to all of this. It is called the Rule of 5 of EKG interpretation. This method will help you break down any EKG strip, step by step, giving you the confidence to identify rhythms quickly and accurately. So, not just for the NCLEX, but also for real life. So, if EKG has been one of those areas that you feel weakness, if EKGs have ever made you second guess yourself, this video is for you. So let me simplify it and let's begin with the Rule of 5 of EKG interpretation. Who's ready to begin this training? Let me know. Let me know if you're ready to begin this training today. If you're new to the channel, make sure that you are subscribed to our channel so you don't miss any of the information. Make sure to hit the bell, activate the bell, so you get notified next time I am live or I upload any new content. Okay, Marian is ready. Esther is ready. Very good. So let's begin with the rule of 5 of EKG interpretation. Basically, the rule of 5 is you're going to use to identify and to interpret EKG strips. The rule of 5 represents rhythm, rate, whether it is atrial or ventricular rate, the PR interval, the QRS interval, and identifying the relationship between the P wave and the QRS. So you're going to take this strategy, and when you see an EKG strip, you're going to go step by step. You're going to identify if the rhythm is regular or irregular. You're going to see what is the rate of that EKG strip. You're going to measure the PR interval and identify if it's within the normal parameters or if the PR interval is prolonged. You're going to also measure the QRS interval. And lastly, you're going to make sure there are a P wave and QRS all the time. You want to make sure that there are not missing QRS complexes. You want to make sure that if you're looking at missing QRS complexes, that could indicate a heart block. So I want to take this step by step so you can learn how to do each one of these steps in the rule of 5 of EKG interpretation. So let's begin with the rhythm. And just for the purpose of today's presentation, I am going to show you how to identify the ventricular rhythm. You can also do it with the atrial rhythm, but just for the purpose of the presentation, I'm only going to show the ventricular rhythm. So how are you going to do it? Basically, you're going to examine the R to R interval on the EKG strip. And you're going to ask this question. Are they regular? Meaning that each heartbeat is equal when it comes to the R to R interval. You're going to ask yourself, is this rhythm regular or irregular? Meaning there is an increased duration in the R to R interval. What does this mean, Professor? Show me an example. So let me show you an example so you understand. This is a regular rhythm. How do I determine that? Basically, you're going to look at the R to R intervals. How do you find the R to R intervals? Basically, you're going to find the QRS complex. So here's the R. Here's the R. This is what is called an R to R interval. And what you want to do is you want to count the small squares. Remember, on day 1, I talked to you about the difference between the big squares and the small squares. So in this one, you're going to count the small squares, and you're going to see that in the first R to R interval, there are 17 small squares. When we go to the second R to R interval, we see that there are also 17 small squares. And so on as we go from one R to R to the next R to R interval. In each scenario, you're going to see that there are, in this case, in this strip, 17 small squares. So this is regular. That's how you identify that this rhythm is regular. Now, let me show you an example of an irregular rhythm. When we do the R to R interval and we count those small squares, you're going to see that it varies. For example, in the first R to R interval, we see 13 squares. However, on the third R to R interval, we see 8 squares. But on the last R to R interval, we see 17 squares. So we can see here that is not regular, as we saw on the first strip. So this is how you identify if the rhythm is regular or irregular. Does that make sense so far? Do you understand so far? Let me know in the comment section. Does that make sense? Because it's going to get very interesting very soon. Okay? Makes sense? Very good. All right, so let's continue. Now you know how to identify the rhythm. Let me show you how to identify the heart rate. Okay? So there are several methods that you can use to identify heart rate. One of the easiest method is counting the number of QRS complexes over a 6-second strip and then multiply it by 10. This is the easy method. However, you need to understand that this method works very well for both regular and irregular rhythms, but you need to make sure you're looking at a 6-second strip. Now, here is the good news. On the NCLEX, every strip that they're going to show you is going to be a 6-second strip. Therefore, you can use this method, which is the easiest one. All you have to do is count the QRS complexes in 6 seconds and multiply by 10. So let's say if you have 7 QRS complexes in a 6-second strip, 7 times 10, 70. That's your heart rate. Now, it's going to be an approximate heart rate. However, I also want to show you the second method is a little bit more difficult to do, and it's important to know that for the second method, you need to make sure you have a regular rhythm. If the rhythm is irregular, you cannot use the second method. So the second method basically is you count the small boxes, the amount of small boxes between R to R. And then you're going to divide this number into 1,500. By this way, you will be determining the heart rate. So, for example, here is a scenario. Let's use method number 1, which is the easiest method, counting the QRS complexes and multiply it by 10. So, in the scenario that I showed you, we see that there are 7 QRS complexes. You see it here? 1, 2, 3, 4, 5, 6, and 7. 7 times 10, 70. So what is this patient's heart rate? 70 beats per minute. So easy, very easy process in order to identify the correct heart rate. Now, let's go to step number 3, which is step number 1, which is identifying the rhythm. This is step number 2, identifying the heart rate. Let's go to step number 3, which is to identify the PR interval, which is going to measure the atrioventricular conduction time. As you can see on this image on the right, the PR interval is measured from the beginning of the P to the beginning of the QRS complex. Now, normally, the PR interval is going to measure between 0.12 to 0.20 seconds. Basically, anywhere between 3 to 5 small boxes in adults. Okay? Now, after evaluating or identifying the AV conduction time, You also need to identify, or you need to evaluate, if the PR interval are constant or if it varies across the EKG strip. Why is that important? Why do I need to pay attention to the PR interval? Not only if it's within the normal time frame, which is 0.12 to 0.20, but what is another reason why I need to monitor if the PR interval are constant or if it varies? Why? Why is that important? Can you tell me? Can you comment in the comment section why is that is important? Let's see if you know. Why is that important? I'm gonna give you a few seconds to think about it. Anybody? No? You don't know why? It's important. This is important for the NCLEX. The reason why it is important to identify if the PR interval is a constant or if it varies is because that is going to give us information about heart blocks. For example, when we talk about a first-degree heart block, the only thing we are going to see in a first-degree heart block is prolongation of the PR interval is going to be greater than 0.20, but it's going to be constant at all times. However, when we look at a second-degree type 1 heart block, the PR interval varies. It's going to be longer, longer, longer until the QRS drops. So it is important to know this. Okay? So once you've determined that the PR interval falls between the normal boundaries, which is 0.12 to 0.20, then you're going to identify if it's constant or if it varies across the electrocardiogram strip or tracing. This is step number 3. Step number 4, you're going to analyze the QT interval. So we've talked about the PR interval, which is the space between the P and the R. Now we're going to measure the QT interval. The QT interval basically measures the period of depolarization and repolarization. It is important to know that the QT interval can vary depending on gender, depending on age, and also the heart rate. Now, lastly, you need to determine what is the relationship between P wave and QRS. Why is this important? Can somebody tell me? Why is it important to identify the relationship between P waves and QRS complexes? The reason why that is important is to determine also if there is a heart block. For example, in a first-degree heart block, there's always a P and a QRS complex. In a second-degree type 1 heart block, we have a difference. Now, not only we have a PR interval that is prolonged every time, but then suddenly, usually after the third or fourth beat, the QRS drops. So now you see a strip that have a P wave, no QRS, and then another P wave. So there is something wrong in between the relationship between the P wave and the QRS. That will help you determine a second degree type 1 heart block. Now, let's say, for example, a third degree heart block, there is no relationship whatsoever between the P wave and the QRS complexes. But don't worry, that's for another day. I will talk to you about how to identify heart blocks in another day of this EKG series. So, for example, let me show you this EKG strip here. So if I ask you, what is the relationship between the P wave and the QRS complexes in here, you can say the following. Well, in here, I have a P wave, and then I have a QRS complex. I have a P wave and a QRS complex. I have a P wave and a QRS complex. And then I have a P wave and a missing QRS complex. So we have a heart block. Why? Because I don't have a P and a QRS all the time. There are missing QRS complex. In this case, there are also prolongation of the PER interval is longer, longer, longer drop. So this is a second degree type 1 heart block. Now, let me show you another scenario. Look what is going on here. We have a P wave here, no QRS. P wave here, no QRS. We have a QRS here, no P wave. P wave, no QRS. P wave, no QRS. QRS, no P wave. We got a big chaos here. So what is going on? What is happening here? We have another heart block. Now, which one? We have a third degree heart block. Why? There is no correlation between the P wave and the QRS complex. Okay? So this is important to identify or to interpret an EKG appropriately. Now, the first thing that you need to identify is normal sinus rhythm. So what do I need to see in order for my strip to be a normal sinus rhythm? Basically, everything needs to be normal. Normal sinus rhythm is the standard rhythm of a healthy heart. It originates from the sinoatrial node or SA node, which basically, as you learned in day 1, it acts as the natural pacemaker of the heart. Now, here are the key characteristics of normal sinus rhythm. The rate is between 60 to 100 beats per minute in an adult at rest. The rhythm is regular. So when we measure the R to R interval, we're going to measure the same distance. The P wave is present in every QRS complex or before a QRS complex. The PR interval is normal between 0.12 and 0.20 seconds. It's going to be constant from beat to beat, and the QRS complex is going to be narrow, less than or equal to 0.10 seconds. And basically, it's going to follow every P wave, meaning you're going to see a P wave and then the QRS complex. So if you see this, you are in front of a normal sinus rhythm strip. Here is the strip that shows that example. Rate is normal. How do I know that rate is normal? Well, let's count it. Let's do it. Let's use method number 1. So the first thing is that we need to make sure that we are looking at a 6-second strip. So we're going to count 30 big squares. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, plus 15, 30, 30 big square. I do have a 6-second strip. So what are we going to do? We're going to count the amount of QRS. So we see here 1, 2, 3, 4, 5, 6, 7, 8 times 10, 80. That is the heart rate in this patient. The easy method. 80. That's the heart rate. The rhythm is regular. There's a P wave before every QRS. The PR interval is normal between 0.12 and 0.20 seconds. And the QRS complex is narrow and less than 0.10 seconds. This is normal sinus rhythm. Let's go to the next one. Sinus bradycardia. Sinus bradycardia is a rhythm that also originates in the SA node. It is very similar to normal sinus rhythm. The only difference is that the heart rate is slower than normal. So it's going to be less than 60 beats per minute. But everything else is going to be exactly the same. The rhythm, regular. There's going to be a P wave before every QRS. The PR interval is going to be normal. The QRS complex is going to be normal. What's the heart rate here? Well, let's see if we have a 6-second strip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, plus 15, 30 big squares. I have a 6-second strip. Let's count the amount of QRS. 1, 2, 3, 4 times 10, 40. The approximate heart rate is 40 beats per minute. Everything else is normal. What do I have? Sinus bradycardia. Sinus tachycardia is also a rhythm that originates from the SA node, just like normal sinus rhythm, but in this scenario, instead of being slower than 60 beats per minute, it's going to be greater than 100 beats per minute. But everything else is going to be just like normal sinus rhythm. Rhythm regular, P wave before every QRS, PR interval normal, QRS normal. The only difference is that the heart rate is going to be faster or more than 100. So what is the heart rate here in this scenario? Well, let's count it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 140 beats per minute. There is a P before every QRS. The PR interval is normal. We have sinus tachycardia. Now, let me show you a chart where I can show you a comparison between normal sinus rhythm, bradycardia, and tachycardia. And let's analyze it one by one. So, when we talk about the origin, so in normal sinus rhythm, sinus bradycardia, and sinus tachycardia, the origin is going to be the SA node. The heart rate, as you know, in normal sinus rhythm, 60 to 100. Sinus bradycardia, less than 60 in an adult. Sinus tachycardia, greater than 100 in an adult. The rhythm, see that is regular on the three scenarios. There's always a P before every QRS. The PR interval is normal. The QRS complex is normal. And when it comes to treatment, which we're not going to go in detail today, for normal sinus rhythm, everything is normal. I don't need to provide treatment. Sinus bradycardia, treatment is if the patient is asymptomatic, is symptomatic. I'm sorry. Because, for example, athletes can have sinus bradycardia completely asymptomatic, and they're so if the patient has sinus bradycardia without symptoms, continue to monitor for the NCLEX. However, if the patient has sinus bradycardia with signs of hemodynamics instability, then you need to treat the patient. When we talk about sinus tachycardia, usually we don't treat the rhythm. We treat the underlying cause. Why? Most of the time, sinus tachycardia could be either because of fever, pain, anxiety. So how do we fix the sinus tachycardia? Fix the underlying problem. If the problem is fever, give an antipyretic, and you're going to take care of the tachycardia. If the problem is pain, give a pain medication, and you're going to take care of the tachycardia. If the problem is anxiety, give anti-anxiety medication, and you're going to take care of the tachycardia. All right? Okay. Well, let's see if you've learned. So I ask you this question. If you look at this strip, is this strip showing a regular or irregular rhythm? Comment in the comment section. What do you think? Is this a regular or irregular rhythm? Remember the process. You have to count the R to R, the R to R interval, count the small squares. You can also count the big squares, but sometimes you have to look at the smaller square to actually get to the correct analysis. But what we're going to see here is very simple to see that this is an irregular. This is an irregular rhythm. How do I know that? Look at the distance between here to here. We have 1, 2, 3, 4 big squares and 1, 2, 3 small squares. So 4 big square and about 3.5 small squares. Let's go to the next one. From here to here, we have 1, 2, 3, 4 big square and almost 5 smaller squares, a little bit bigger. But look now, from here to here is a big difference. 1, 2, 3, 4, 5, 6, 7 big squares. So 1, 2, 3, 4 big squares, 4 big squares, but 7 big squares here. And then from here to here, we have 1, 2, 3, 4, 5, 6 big squares. Irregular. See? It's very easy to do. Very easy to do. Now, how about this one here? How about this one here? Is this regular or irregular? What do you think? Is this regular or irregular? Okay, let's see. Let's count. So let's measure from this R to this R. 1, 2, 3, 4 big squares and 4 small squares. Let's go from here to here. 1, 2, 3, 4, 5. So we see a difference from here to here. 1, 2, 3, 4, 5. Okay, let's see. We saw a little difference on the first one. Let's go to this one here. 1, 2, 3, 4, 5. The same. Let's go from here to here. 1, 2, 3, 4, 5. Okay, so there was only one small square difference on the first one. That is okay. Just a 1 to 2 small square difference is okay. So this is a regular rhythm. This is a regular rhythm. Okay, now, if I ask you, this is a regular rhythm, but what is the heart rate? What would you say is the heart rate in this strip using the first method? What is the heart rate? Okay, got 1, 2, 3, 4, 5, 6. So 60 to 100, that's normal. Now, what is the PR interval? Is it normal? Is it constant? Or does it vary? Let's see. Remember, we measured the PR interval from the beginning of the P to the beginning of the Q. Or I'm sorry, it's very hard to do the drawing with the mouse. So we have 1, 2, 3, 4, 5, 6. So 1, 2, 3, 4, 5, 6.5. So 6 small squares. What do you think about that? So it's normal. Some of them have 5 and a little bit more. So it's normal. It's constant. So the PR interval is completely normal. Okay, how about this one here? What would you recognize this rhythm here, this strip? What would you say this strip is? If the rhythm is normal, if the PR interval is normal, if there is a P before every QRS, if the QRS is normal, what would you interpret this strip as? So I know that for like watching or either on the phone or the computer, it might be a little bit too small to measure it yourself, okay? So I know it's a little bit hard. I wanted to give you a bigger picture, okay? So this is normal sinus rhythm. If it's regular, PR interval is normal, QRS is normal, there's a P before every QRS, you have a normal sinus rhythm. Now, how about this one? What would you interpret this strip as? So basically, look at the R2R interval to determine if it's regular or irregular. Identify the rate using method number 1, which is counting the QRS complex and multiply by 10 and get a heart rate. Analyze the PR interval to see if it looks normal, if it's constant, or if it varies. Look at the QRS interval. And then look if there is a P and a QRS, and if it's constant or if there are any missing pieces. So the rhythm is regular. Like when we count, the distance is 2 big square and 3 small squares. 2 big square, 3 small squares. 2 big square, 3 small squares. So it is constant. The heart rate, well, let's use the method of counting the QRS. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 times 10, 120. So regular, heart rate 120, PR interval normal, QRS normal. There's a P before every QRS. Everything is normal with the exception of the heart rate that it is greater than 100. What is this EKG strip? This is sinus tachycardia. Okay, so far in this EKG series, in day one, I talked to you a little bit about the structure of the heart, the different parts of the heart, the function of the heart within the cardiovascular system. We talked about valves. We talked a little bit about the chambers. We talked about the nomenclature of the EKG. We talked about what each part of the electrocardiogram represents, like atrial depolarization, all this fancy stuff we discussed on day one. Day two, we discussed a little bit of what is normal sinus rhythm, sinus bradycardia, and sinus tachycardia. I showed you the rule of 5 of EKG interpretation. So this is very, very interesting. Okay, now you cannot miss day 3. If you've been with us for day 1 and day 2 of our EKG series, you have already started to build a solid foundation in rhythm interpretation. And this is very important. If for some reason you haven't seen day 1 and day 2, if you're listening to this later on and you haven't seen day 1 and day 2, you need to go back to day 1 and day 2. But we're not stopping here. On day 3, we're taking this to the next level, because knowing what the rhythm is important, but it's only one part of the equation. Now it is time to learn what are you going to do as a nurse when you have a patient with a situation such as sinus bradycardia, sinus tachycardia, atrial fibrillation, atrial flutter. What are the nursing responsibilities for those patients? We're going to break down the most common EKG rhythms that you will see on the NCLEX and also in clinical settings. We're going to discuss a little bit about the treatments and nursing interventions. So we'll talk about medication, pharmacology. That is important. Nursing interventions that are essential to know to pass the NCLEX. So do not miss day 3 of our EKG series, where everything is going to begin starting. Everything's going to become together. Make sure you're joining us on day 3. Thank you, ladies and gentlemen, for being here. God bless you all. I'll see you on the next training. Have a good, wonderful night.
Are you ready to take your NCLEX prep to the next level? Join our exclusive YouTube Premium membership and gain access to powerful resources that'll help you dominate the NCLEX step by step. Bronze membership. For just a small investment, you'll stand out in our community with a special member badge, and you'll get priority message replies to ensure your questions never go unanswered. Upgrade to Silver membership. You'll get everything in Bronze plus exclusive members-only videos packed with NCLEX strategies. Practice questions on video format to test your knowledge and sharpen your skills. With Silver, you're not just watching, you're actively preparing. Want the ultimate NCLEX advantage? Then Platinum membership is for you. Along with everything in Bronze and Silver, you'll get exclusive access to the next generation NCLEX Master Course. No matter where you are in your NCLEX journey, we have a membership tier designed just for you. Click the join button now and start your path to NCLEX success today.